Good afternoon, everyone. Welcome to Module 13G. And here we'll be discussing about assisting with elimination. Assisting with an elimination. Part of our core duty as home health aides or personal care aides is to assist our patients with elimination, that is, passing of feces or urine. As we know that some patients may patients who are 100% dependent, they will need assistance with factually everything, including elimination. So patients that are not all dependent may need assistance with elimination, as the case may be. So without wasting time, we'll move quickly to the introduction. As we know that every patient has elimination needs, and there are numbers of ways in which a home health aide or a personal care aide can assist the patient by providing elimination needs, helping them with elimination needs. Patients who are unable to get out of bed due to probably mobility issues or injury may benefit from using a bedpan. Male patients may benefit from using a urinal at the bedside, prevents having to walk to the bathroom. And some male have condom catheters, which are external urinal drainage system, where a condom is applied to the penis and attached to a urinary drainage bag, just to help with what urination. Other patients may have indwelling catheters in which the catheter is inserted into their bladder. The catheter is then attached to an external urinary bag, and the home health aide or the personal care aide has an important role in providing assistance with elimination and cleansing the genital area after elimination. So this section will explore how to offer a patient a bedpan or urinal, or how to apply a condom catheter, and how to cleanse the genital area and catheter tubing. The instruction is provided about how to empty urinary drainage bags that are attached to condom catheters and indwelling catheters, and how to properly measure urine output. So let's look at the procedure for using a bedpan. What are bedpan? Bedpans, like a patient who are unable to get out of bed may need to use a bedpan when urinating or for bowel movement. Bedpans can be used for urination and also for bowel movement, that's passing out of feces. So the standard bedpan looks like a toilet seat and has a wide, high rim. These types of bedpans are placed under the patient with the widest end under their buttocks. Now, the fracture pan has a lower and a thinner rim. The smaller and the flatter end is placed under the buttocks. Now, whichever the one you use, the higher end with the handle is placed facing the patient's feet. So the fracture pan should be used for patients who are unable to lift their hips for bedpan placement after a back or a spinal injury or surgery. This is an example of placing our bedpan. Now, so how do the procedure goes? The first thing is to explain the procedure to the patient. Then you wash and you dry your hands. Always apply gloves when offering and removing a bedpan. Adjust the bed to a safe work height. Then you lock the brakes, lower the head of the bed, and then you position the patient in a supine position. Provide privacy for the patient by closing the doors and the curtains. You fold down top linens just enough to slide the bedpan under the patient. Then you place a towel or disposable protective pad under the patient as needed. This helps to protect the bed linen from getting urine or feces on it in case of accidental spilling of bedpan content. Then assist the patient with removing the pants and undergarments if they are unable to do so by themselves. Home health aides Home health aides or personal care aides can dust the bedpan with talcum powder to help prevent the patient's skin from sticking to the bedpan. Then check with a supervisor before doing so. Then you ensure the patient does not have an allergy to that powder. Place the bedpan near the hips of the patient. Position a standard bedpan with the wider edge aligned with the buttocks. Then you position a fracture pan with the flatter end under the patient buttocks and the handle towards the foot of the bed. If the patient is able, they can bend their knees and lift their hip as they slide the bedpan under their buttocks. But if not, you can provide assistance for the patient as they raise their hips by placing one hand at the small of their back to help raise their buttocks. So if the patient is unable to lift their hips, you can roll them to the side, facing opposite to you. Position the waterproof pad under the patient buttock, then position the bedpan under their buttocks, pressing firmly or gently downward on the bedpan against their buttocks. So you hold the bedpan securely against the patient as you roll the patient back towards you. Check to ensure the bedpan is adequately underneath the patient's buttocks. Now ensure a blanket is covering the patient to provide privacy. Then you provide privacy, you raise the head of the bed if the patient prefers so that the patient is more closely in a sitting position than a lying position. So this position allows for a more natural feel for the patient to eliminate. Then you can raise the side rails of the bed. Provide the patient with a toilet paper, dispose of your gloves and then you wash your hand. When the patient has finished using the bedpan, put on another one, another clean gloves. Then you can lower the head of the bed so that the patient is put into a supine position. If the patient is able, ask them to lift their hips. And while they do this, firmly grasp the bedpan and remove it from under them. Then assist with cleaning the patient's perineum as appropriate. If the patient is unable to lift their hips, assist the patient to roll to the side facing away from you. While the patient is rolling, ensure you have a firm grasp on the bedpan. You may have to have one hand on the patient's hip to assist in rolling, and use your free hand to grasp the bedpan and remove the bedpan. So, clean the patient's perineum for female patients. You can wipe the buttocks from front to back away from the vaginal area, and this ensures that bacteria from the anal area and the feces do not enter into the vaginal area and cause possible infection. Then you lower the bed to its lowest setting for safety. Reposition the patients for comfort and ensure the side rails are raised. Then dispose of the contents of the bedpan into the toilet. Rinse and clean the bedpan with hot and soapy water. Then you dry and pull the bedpan away. Measure the urine as required, then document output of urine or feces as appropriate. Dispose of your gloves and wash your hands, and then dry your hands and document the procedure. And any observations or changes in the patient's condition or the patient's behavior. So how do we make use of a urinal? We know that a urinal usually used for males and may only take urine, while bedpan can be used for both urine and feces, but mostly in female patients. So the use of urinal helps the male patient to quietly and safely urinate without having to ambulate to the bathroom or commode. Many male patients may find it easier to urinate in a high sitting or a standing position to assist the patient into a position that they are most comfortable and they can safely assume during urination. And home health aides or personal care aides may need to assist some patients with positioning and holding the urinal while they urinate. Then you explain the procedure to the patient, wash your hands, and don gloves. Then you provide privacy for your patients. Adjust the bed to a safe working height. You lock the bed rails, you raise the head of the bed and put the patient in a sitting position in the bed or at the side of the bed. Alternatively, you can assist the patients to a standing position. Refer to procedures transfer to a sitting position in bed procedure, helping the patient to sit at the side of the bed and helping the patient to stand. So place a protective pad or a towel under the patient's feet as needed. And if the patient is able, hand them the urinal to use for themselves. If the patient requires assistance, you can place the urinal between the patient's legs, position the head of the penis into the urinal, ensuring it is completely inside the container. Then if the patient while assisting with urination, allow for quiet during this time. Provide privacy by covering the patient with a blanket if they are in bed. So if the patient is not in bed, you can give them a bed control by themselves, as earlier. So provide privacy, which is very important for the patient to urinate if they do not require assistance by leaving the room for them. But remember to always check on the patient every 5 minutes or knock before entering at each interval. Then you can provide the toilet paper to clean up. So discard your gloves and wash your hands. When the patient has finished the urinal, you wash your hands again and you put on clean gloves. Then close the cap of the urinal. After that, you can lower the bed to the lowest height and ensure that the bed rails are raised to remove the urinal from the supplies. You measure the urine and record the output as required, color, the everything. Then you dispose the urine into the toilet, then flush that toilet. Rinse and then store the urinal. Do not store a urinal on a bedside table. Hang the urinal on a bed rail near the patient so they can easily have access to it. Then you dispose of the gloves, then you wash your hands and dry your hands. Then you document the procedure on completion and any observation or changes in patient's condition or in patient's behavior. Now, assisting with use of a condom catheter. Condom catheters are worn by some males to assist with urination. This urinary drainage system allows the patient to engage in their normal activities while not having to be concerned about problems with urination such as incontinence. It is a very less invasive urinary drainage system that can be than an ingrown catheter and has a low risk of infection. And it's important for home health care, the personal care aides to ensure the tubing to this urinary drainage system is not kink or twisted, and that the drainage collection bag is worn below the level of the bladder. Then explain the procedure to the patient. And this is an example of a condom catheter and the urinary bag for a male, and that's for a female there. So how do you do it? You wash your hands and apply your gloves. Assemble your equipment in there, your soap, your washcloth, the towel, the condom catheter, the skin protectant, and the drainage bag. When you raise the bed to a safe working height, you lock the brakes, place the patient on a supine position. Then you maintain the patient's privacy, only expose the genital area. Remove the old condom catheter if one has been used before. So by what? By detach it from the drainage system and then you roll the condom down and off the penis, starting at the base of the penis and rolling towards the tip of the penis, and you dispose of the old condom catheter. So wash the penis carefully with soap and warm water, like temperature not more than 105 degrees Fahrenheit. For uncircumcised males, you pull the foreskin down then the shaft of the penis, and then you clean the hair. That's the glands of the penis. The glands of the penis should be washed using a circular motion from the opening of the urinary meatus outward. Wash the shaft of the penis using downward strokes. Then dry well. Remember to move the foreskin back up. And if the foreskin is not reduced, you can put back into the original place. Swelling will result due to circulation if blood to the penis is being cut off. So you observe the penis for sores, open areas or red areas or broken skin. You attach the condom catheter to tubing and collect and to the pin of the collecting system, and you push the pubic hair away from the shaft of the penis to prevent it from sticking to the skin protectant or condition or the condom. To prevent the skin from what attaching. Then apply skin protectant to the shaft of the penis and allow it to dry. So if you don't like it to dry, it may not work and can be sticky. So hold the base of the penis with your non-dominant hand. With your dominant hand, you can roll the condom catheter onto the penis, starting at the tip of the penis, then over the shaft of the penis towards the base. Leave about 1 inch of space between the glands of the penis and the drainage tip to prevent irritation. If the tape is being used to secure the condom in place, apply it in a spiral manner, starting at the top of the penis, working downward. Ensure that the tubing for the collection system is connected to the condom. Then you secure the tubing to the patient's thigh with tape, a Velcro leg strap, or the method directed by the agency. Then you ensure that the tip of the condom is not twisted. Don't allow it to be twisted. You ensure that the tubing also the collecting system is not kinked also or twisted. The tube is not kinked or twisted. The condom itself is not twisted or kinked. Then the collection system tubing also and the drainage bag should always be kept below the level of the bladder. Please ensure that urine from the drainage bag does not move back up to the penis. And you can lower the bed to its lowest position and ensure bed rails are raised. And you discard juice supplies, discard gloves and wash your hands. Then you document application of the condom catheter and any skin conditions such as sores, swelling, redness, or raw areas observed. Now, procedure for assisting with cleaning the skin and the catheter tubing. So this is another procedure entirely. You don't just use the catheter tubing anyhow. They get cleaned. Even the skin too should be cleaned. The first thing we do is to provide personal hygiene care, as it is an important part of the home health care, the personal care aids job. So cleaning the catheter tubing should be completed on a daily basis when providing bathing and perineal care for the patient. So you can explain the procedure to the patient as usual. Then you wash and then dry your hands, then you apply your gloves. After that, you gather the equipment and supplies that you'll be needing: the soap, the washcloth, the towels, the waterproof pad. Then you can raise the bed to a safe working height. You can lock the brakes as well. Then provide for patient's privacy. You can expose only the genital area where you'll be working on. Then position the patient on their back to expose the perineal area and the catheter tubing. Place a towel or disposable protective pad under the patient. Then you can wash the patient's genital area gently with soap and warm water, no greater than 105 degrees Fahrenheit. For males, starting at the meatus, urinary opening, that's what I mean, and the clean outward of the, you can clean outward in a circular motion. Clean the shaft of the penis with a downward stroke. For uncircumcised male, you can usually push back the foreskin, clean under the area, then you can use the clean area of the waistbelt to stroke. Then remember to replace the foreskin back, like the normal procedure I've always talked about. But for female patients, you separate labia using a clean part of the washcloth or the wipe, and then you wipe from front to back on each side using a clean part of the washcloth for each stroke. Wipe from the top to the bottom and in the middle of the opening, in the middle of the opening of the vagina. Then you clean the area between the vagina and the anus last. Then washing from front to back, not from back to front. Never move from what back to front. So take care of not to pull on the catheter at any time, as this would cause injury to the patient. The catheter tip is inside the bladder. Pulling on the tubing could cause what? Injury to the bladder. So hold the tubing with one hand close to the meatus, that's the urinary opening. So while gently closing the length of the tubing, starting from the point of entry, that urinary opening, and moving down to the tubing. A warm soapy washcloth can be used unless otherwise directed in the care plan. Then you can replace the clean washcloth as needed. Then when you are done washing the tube, you can use a clean and a wet washcloth to rinse the tubing. Then always move from the urinary opening downward, never clean from bottom to the part of the urinary tubing, because what this can introduce bacteria into the urinary system. So always clean from the urinary tube, the meatus down to the tubing, to the bag, out, from inside out. So observe the genital area around the catheter for sores, swelling, for crusting, for leakage, or possible bleeding. Then document and report these observations. Ensure the catheter tubing is taped or that a catheter securement device is in place according to the care plan. Then you position the patient so that the catheter tubing does not kink or pull. The urinary drainage bag should be below the level of the patient's bladder. Dispose of dirty linens and water. Remove the bed protector or towel from under the patient. Then lower the bed to its lowest setting and ensure side rails are up for patient safety. Then you can discard your gloves and wash your hands. Record exam of procedure and any observation or changes in behavior or patient's condition. The next thing we're talking about now is assisting with emptying the urinary drainage bag. Of course, over time, the urinary bag will get filled up with urine and they need to be emptied. So how do we assist with emptying a urinary drainage bag? Drainage bags on urinary collection systems, such as those from indwelling catheters or condom catheters, need to be emptied on a regular basis. So home health aides or personal care aides should frequently check that the tubing on catheter system is not twisted or kinked. Home health aides or personal care aides should always ensure that drainage bags are below bladder level. So never hang them on bed rails as the bag will move when the bed rails are lowered or raised. So you can now, after all these are done, you explain the patient, then you wash your hand and don your gloves by putting on clean gloves. Then assemble the equipment that you need for the procedure, like a measuring pitcher or the graduated cylinder. So or the calibrated cylinder too as well. So place the measuring pitcher or the graduated cylinder below the drainage bag on a paper towel. You can release the drain from the beholder and use the clamp on the drainage bag without allowing the drain to touch the measuring cylinder. Never allow the drain to touch the measuring cylinder. Allow contents to pour into the measuring container directly from the drainage bag, and take care to prevent urine from splashing onto your face or to the floor or to your clothing. Then clamp the drainage bag and clean the end of the drain with an alcohol wipe. Then position the clamp back into its position, that's into its holder. Then you cannot measure the amount of urine at the eye level while it is sitting on a flat surface, recording it as output. Then dispose of urine in the toilet, flush, then clean the measuring container and store. You can discard gloves and wash your hands. Document procedure, the output, and any observed changes in behavior or condition. Then you can report observations about changes in urine color, the odor, the amount, or the characteristics such as cloudiness, mucus, or blood present. Note the condition of the drainage bag and the catheter tubing. Then you can report concerns or the need to replace catheter tubing or drainage bag to the supervisor whenever it is needed. So next one now, we're talking about the measuring the urinary output. How do we measure the urinary output? Fluid that is taken in must be eliminated from the body. Now, fluid intake should at least be equivalent to fluid output. So fluid taken in should be eliminated in the body. So urine is restricted. So the urine that is restricted from the body is called output. Now, it is important that the home health or personal care aid is to measure the output of their patient to ensure their optimal health. A patient may have a condition in which the healthcare provider wants to ensure that they have a good take in that intake and equals to what they put output. And this is to ensure adequate fluid balance. Fluids are usually measured using milliliters, and the agents will specify the units of measurement the home health and personal care aid should use. The urinals and catheter drainage system have measuring lines on a system for the patients who use a toilet, commode, or bedpan. Urine contents can be emptied into a graduated or other measuring picture. Sorry about that. My measuring picture to provide an accurate measurement of output. Contents can be disposed of down the toilet once urine has been measured. So what do? You explain the procedure to the patient because it's an important part of the procedure, like measuring the urine output is very important part. So you have to be aware of that. Always wash your hands and done your global measuring and output, then pour urine from a bedpan or from a commode or urinal or using bed bag or bed bag or urinal, sorry. So you can pour your urine from a bedpan, commode, urinal, or urinary drain bag onto measuring picture or cylinder. Then place the measuring picture on a paper towel on a flat surface. Note the amount of urine at eye level. What is my eye level? Bring it up to your eye level like this. So place the measuring picture on a paper towel on a flat surface and note the amount of urine at the eye level. Record the amount in mil. Then discard the urine into the toilet and you flush unless the urine is there for specimen. If you notice anything unusual or anything abnormal in the urine, save the urine to be inspected by the supervisor, or if otherwise, can flush the toilet. But if not, if there's anything that is there, you have to keep it in wait for the doctor, for the supervisor. Then store equipment in the appropriate place. Discard gloves and wash your hands. Document all outputs. Report any observation or changes in condition of behavior, and then you record and report changes of characteristics of urine, including the color, the odor, the blood, or even the mucus in the urine. So if the patient has difficulty or pain while urinating, you also note that one. You record and report these two. And with that, we have come to the end of how to eliminate that, how to pass out this urinary output. So in one word or in a summary, what we discussed about starting directly today is that we talked about helping a patient with elimination. You talk about patients that are needing this kind of procedure. That's the very weak, the frail, the 100% dependent patients. Then we talked about assisting with cleaning the skin and also the catheter treatment. We talked about assisting with emptying the drainage system bag, and that was where we ended the class today. So please enjoy the rest of the day and have a wonderful time. See you next class.